Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 130, and today I'm going to be talking to you guys about how Medicare Advantage plans are going to totally destroy the quality of care inside of the hearing aid industry. But before I get into this video, if you could do me a huge favor, click that like button. You know it helps out my channel. I really appreciate it. And if you like this type of content, make sure that you subscribe and hit that notification bell. Now, right off the bat here, before I get started with this particular topic, just know that next week I'm going to be giving you guys a big update on the podcast. We actually identified a new studio, and I will be giving you some video footage from that studio this next week. So make sure that you tune in next week to next week's vlog. All right, that out of the way, let's go ahead and talk about why I believe that Medicare Advantage plans are going to destroy the quality of hearing healthcare. So here's the thing. When you become of Medicare age, you have two options essentially. You can either go and get Medicare, traditional Medicare, and then maybe even get a supplement to cover the things that Medicare doesn't cover, or you can go the Medicare Advantage route, which is kind of like everything all included inside of that coverage. But Medicare Advantage is actually run by private companies that bid to CMS. So the Centers for Medicare Medicaid Services, I think, CMS in other terms. And essentially CMS pays them money on a monthly basis, and then it's the job of Medicare Advantage to make sure that whatever insurance benefits that they provide, Now, some people with hearing loss have been going the Medicare Advantage route because at least some of these Medicare Advantage plans actually have hearing aid benefits in them, whereas traditional Medicare, as you probably know at this point, does not have hearing aid benefits. But the problem that we run into here with Medicare Advantage plans is that their job is to basically be profitable, all right? So not a whole lot different from my clinic. Like, my clinic needs to be profitable. I understand that these Medicare Advantage plans need to be profitable. But the way that they are able to be profitable is by reducing waste, right? So if you are someone who needs a procedure, they will do everything in their power to try to see like if there's a lower cost procedure that you can do instead so they can save money and essentially not pay out. So the way that they really make money is by paying out less than what they bring in from CMS. And then the other thing that they do is that they actually restrict your access to care. So you can only go to certain providers that are within their network, and those providers have all agreed to accept a lower reimbursement rate for whatever services that they provide. And this is very similar to how it works for hearing healthcare inside of Medicare Advantage plans. So what's the problem, right? Like, some Medicare Advantage plans, you get pretty good hearing aid benefits. You get to go in, you get to get hearing aids at a lower cost, and everybody's happy, right? Well, the problem is this. And let me just kind of share with you some experiences that I've had inside of my clinic. So I've had some patients who have come in to see me, and they've seen me for a couple of years, and then when it comes time for them to get new hearing aids, or if they lost or damaged their hearing aids, whatever the case may be, they need to get new devices, they come and say, "Cliff, great news! We got hearing aid benefits now, and we need to get new hearing aids." And I'm like, "Oh, that's great. Who's your benefit through?" And they're like, "Well, we have a Medicare Advantage plan now." And I'm like, "Oh, so, well, Medicare, we're not in network with any of the Medicare Advantage plan managed care companies." So how it works is that the Advantage plans, they will contract with a third-party administrator to administer the hearing aid benefit portion of the Medicare Advantage. And, there's a variety of different companies out there, but essentially these third-party managed cares, they only contract with certain hearing care professionals who are willing to take an extremely low rate of reimbursement. So what happens when a hearing aid clinic receives a very low rate of reimbursement? Do you think that they give fantastic quality of care? No, they do not. In fact, they give you the absolute bare minimum care that they can possibly give you, because when you start to look at the numbers, most of these Medicare Advantage plans, when they contract through these third-party administrators, these third-party administrators are essentially giving probably around maybe a seventh of, or roughly, I think it's like a seventh of the revenue that a clinic would get if you were a private pay patient to come in and just say, "Hey, I want to buy hearing aids and I want to pay for my care." Now, that seems great to the individual who has hearing loss. I totally get it, right? I mean, reducing the cost of hearing treatment is fantastic, and I have no arguments against that, unless it's the reason that you can get that price down so low is that you're reducing the quality of care to virtually nothing. So a lot of these managed care companies, they'll give you the provider, this really low rate of reimbursement, and then the patient goes in expecting to get like awesome hearing aids and receive excellent care from their hearing care professional, only to find out that that hearing care professional wants almost nothing to do with you. They just want to get you in, get you out, collect their chunk of money for doing the fitting, and then hopefully not see you again until you need another set of hearing aids. Because if you do go back in, depends on the managed care company, but either they don't get any reimbursement by you coming in for follow-up care, or they can only charge a certain amount, which is extremely low, and there's no incentive for them to do a good job. And that's really where we're at in today's hearing healthcare. And in fact, this is healthcare in general. There are so many people who need treatment for all healthcare, and that treatment is being administered by clinics and clinicians who are hardly getting any money. So what do? They want to churn people. They want to get them in, they want to get them out. And this is really what Medicare Advantage has done with these managed care groups that they contract with for hearing healthcare. It's that they just want to make sure that they can say that they have this benefit inside of their Medicare Advantage plan, because they know that this idea of like, oh, you can get hearing aids through your insurance, which is like, that's a foreign concept. I love that. Only to find out that when you do, you end up going somewhere to get hearing aids that aren't necessarily the ones that are going to be right for you, and you get virtually no care with them. I mean, when you think about the amount of time that is spent with a patient, if you're actually going to follow best practices, it is a significant chunk of time. I think over the course of the first year of patients who come into my clinic, we're spending about 6 to 8 hours with each patient who comes into the clinic. And if you're a managed care, good luck to getting, 45 minutes to an hour worth of care when you go in and you're using your managed care benefits. It's like virtually nothing. And, they just have to dispense the hearing aids to you, fit you really quick with them, and that's all they need to do to get the reimbursement from the Medicare Advantage plan. So it's just really, I don't know, I just feel like it's destroying the quality of hearing healthcare. And I totally understand how you guys might perceive this as being self-serving and saying, oh, like, of course, Cliff, you would want to earn 7 times the amount of money that you get from these managed care groups. Of course, you're not going to participate in them. You're just greedy and you want money. And I just want to be compensated for the quality of care that I am giving. I could totally run a clinic where it is just in and out, churn and burn. I'm just going to fit you with hearing aids really quickly, get you out the door, collect that, and just turn it into a quantity versus quality game. And that's the game that we play. That's the game that all businesses play here in the United States, whether it's hearing healthcare, whether it's regular healthcare, whether it's any other type of business. It's either going to be a quality play or a quantity play, and Medicare Advantage, unfortunately, is a quantity play. And when it comes to someone's hearing, I just don't think that it's worth sacrificing quality for quantity. And here's the other thing. I totally sympathize and understand this idea of affordability and accessibility. I'm not saying that we shouldn't have things to at least make some kind of hearing treatment accessible and affordable to people, and I get it. The problem that we run into is that when you have these Medicare Advantage plans that are becoming like extremely widespread to the point where unless you are an extreme clinic like mine that does not accept any insurance, and that we do things at such a high quality level that people are willing to pay for it, and you have essentially a voice, Dr. Cliff, saying like these are all the things that we do to encourage people to come in, there's going to be a lot of clinics out there that do not have the power of Dr. Cliff sharing this message of quality. So they're not going to be able to get in enough private pay patients to justify providing high quality care. So essentially what we're in right now is a race to the bottom. And it's happening with any type of managed care out there, almost all insurances, if those insurances even pay at all, because somehow that scam is just allowed to continue to go on, where you administer the care and you're fighting for a year to get reimbursed from the insurance. That's one of the main reasons we got out of insurance altogether, but I digress. we're supposed to be talking about Medicare Advantage. You know, what I would say is this. I mean, if you're going to sign up for Medicare Advantage, by all means, if it has hearing aid benefits, by all means, just you have to make sure that you lower your expectation levels accordingly. I would go as far to say is that individuals would likely have more success at a big box store treating their hearing loss than they would going through through their Advantage plan with a managed care that's doing the hearing aid administration, hearing aid benefit through that. And there is no guarantee that if you go through your Advantage plan that you're going to go to someone who does even anything that is beneficial for you. And I know this because I get a ton of patients all the time who come in from their existing clinics that have Medicare Advantage and they're like, Cliff, it was so bad that I'm just willing to pay whatever it takes for you to fix the issue, and that's what it comes down to. So as long as you are aware and you are educated, make sure that you do your due diligence. If you are already going to a hearing care professional and you're like, oh great, you know, here comes Medicare, I can get Medicare Advantage that will cover the cost of my hearing aids, there is a solid chance that if you are extremely happy with your hearing care professional, that they are not in network with that managed care group that your Advantage plan is contracting through. So just keep that in mind. And again, I stress this to everybody, make sure that you're doing your research when it comes down to insurance. You know, I personally hate insurance. The only reason I have insurance is because of a major catastrophic illness. I'm fortunate enough to be able to, if I want to get high quality care, I will pay a concierge doctor to give me care. And honestly, it's not even that much more expensive when you think about it. I pay for an insurance plan that has low premiums, as low as we can possibly get them, with really high deductibles, because again, it's only for emergencies. Now, you have to do what's in your best interest. Totally understand that. I do not begrudge anyone if they chose to go with the Medicare Advantage plan. And, you know, to be honest with you, I would like to hear any stories that you guys have about your experience using Medicare Advantage for your hearing treatment. I'm sure there's some positive stories out there. I'm sure that there's some horror stories out there as well, but make sure that you guys leave those in the comment section below. I'd really appreciate it. That being said, I really appreciate you hearing me vent about this issue. I truly believe that this race to the bottom that is being driven hard by Advantage plans with Medicare Advantage plans is going to be really, really bad for the hearing care profession as a whole, and it's going to be really hard for a lot of clinics that are good clinics to survive because they just can't compete. And that's unfortunate because, like I said last week, I'm scared to see what will happen when I am at the point where I need to get help from a hearing care professional that is not myself, right? And I don't know if there's going to be any quality providers out there because I just don't know if they'll be able to keep their doors open when everything's getting driven to the lowest cost possible. So again, I'm rambling on here. I appreciate you guys. Thank you so much for watching this video, and make sure you hit that like button if you liked it, and I will see you next week.